Hi guys and welcome to another video. In this video we're going to talk about burns and how to treat them. So let's start. Okay, so first off, what are burns? Everyone knows that if you touch something hot then you're going to get burned. But what exactly is happening? What is actually a burn? Well, our skin has three layers. The most upper layer is called the epidermis, and don't worry, you don't need to remember the names. But you should know that the epidermis is the most upper skin layer, the one that we see, and it is built from dead cells. Now, below that skin layer, we have the dermis. That is where we have all of our nerves, our hair fossils, our sweat glands, and all of those kind of stuff. Below that layer, we have the third layer, which is the hypodermis, and that is the fat layer. Now, a first degree burn is when the burn hurts the first layer of the skin, the epidermis. So you can also say that another name for first degree burn can be a mild sunburn. Cool. Now, the second degree of burn is when the burn hurts the second layer of the skin, the dermis. Now, this burn is a lot more painful because that is where we have all our nerve endings. And it is usually, you can tell that someone has a second degree burn if the burn site is red and he has blisters. So blisters are a very good sign for a second degree burn. Now, a third degree burn is when the burn went down all the way to the third layer of the skin, to the fat. This burn, you will usually recognize it by the area would look a bit whitened or even blackened and charred. The person usually will not really have sensation in the area. It will still really hurt, but in the exact area of the burn, he will not really have any sensation. And basically that happens when the burn got all the way to that layer. Now, a fourth degree burn is when the burn went through all of the layers of the skin, all the way to the muscle or even to the bone. Okay, now you should know that burns have a few dangers that come with them, other than, well, being burned. The first danger is loss of blood. The person who got burned doesn't actually need to bleed a lot to lose blood. Apparently, when a person gets burned, then he will lose blood from a few different ways. First off, well, yeah, he can bleed. Second, the blood can actually vaporize. Some of the fluids can vaporize because of the blood, of the burn. And lastly, when a person gets burned, then his veins can get wider, which will reduce his blood pressure and will make him lose some blood as well. So all of these things combined can actually lead to a very decreased blood pressure that can be very dangerous to our patient. Another danger is hypothermia. When a person loses a lot of blood, he doesn't really have a way to keep the warmth of his body, and therefore he can get that. Another thing is infection. At the end of the day, our skin is a layer that is protecting us from viruses, bacteria, and all of the things around us. When a person gets burned, his skin layer gets damaged, and he can really easily get an infection. And lastly, inhalation injuries. Now, this one is really important. When a person breathes in smoke or he breathes in hot air, then he can develop a blockage in his airway, and that way he will not be able to breathe, which is pretty dangerous if you can tell. Now, the thing about inhalation injuries are that they don't develop instantly. The person can feel fine, can act fine, can be fine, and then after a few hours, he can slowly develop this thing. So, just keep this in mind. In case of a burning house or a place where a person might breathe something hot or too much smoke, we should keep this one in mind as well. Okay, and now I want us to talk about the treatment. However, to know exactly how to treat the injury, we should recognize how serious it is. We will treat burns slightly differently if it's a major burn or if it's a minor one. So let's start with recognizing it. First thing we want to recognize about the burn is the location. If our patient has his burn on his face, on his neck, on his chest, on his hands, on his fingers, or on his genitals, then in that case we will consider the burn very dangerous. Next would be to consider the size. Usually we will consider a burn dangerous if it's bigger than our hand. Now, it is worthy to mention, if the burn is really big, for example, 20% of the person's body, then we will really need to worry about other things like hypothermia, loss of blood pressure, and all of the complications around. And lastly, recognizing inhalation injuries. The first thing that would make us suspicious about them is the story of the event. So for example, if our patient was rescued from a burning house, that is a good sign that he might have inhalation injuries. Another one is if he got burned in his face or in his neck. Next is if he has a hoarse voice, if he is coughing, or if he has soot all over his face. In that case, we will be suspicious for inhalation injuries. Okay, now for the treatment. If we recognize that our patient has a serious burn, a major one, then the first thing we would want to do is to call for help immediately. Next thing we would want to do is, if the burn is, for example, on the fingers or something like that, we would want to take off the rings and any tight clothing that he might have, because when a person gets burned, very quickly after, the burn area will swell. Next thing we would want to do is to bandage the area. Now keep in mind, you don't want to use regular bandages, okay? Steer away from regular bandages. After a person got burned, then he has a break in his skin. Bacteria can go in, he can lose body heat and all of those fun stuff. However, if we will use a normal bandage, then it will stick to the burn and it will make more damage than it will make good. So we would always want to use special gas pads that are meant for treating burn injuries. Most of these have like this really weird jelly, like I think it's paraffin jelly, which makes sure that the bandage will not stick to the injury. Then we would want to cover our patient. A person who has a serious burn might lose his body heat really quickly, so we just want to make sure he is warm. And lastly, we would want to give him painkillers if he needs some and he's not allergic. Okay, now for the treatment when we're dealing with minor burns. First thing you would want to do is the same as with serious burns. If it's in the fingers or something like that, you want to make sure you take off any rings or anything like that. Next thing you want to do is you'd want to take the burned area and put it under cool water. Now make sure the water aren't extremely cold, but you'd want to put it under cool water for at least 10 minutes. Okay, and the next thing you'd want to do is to apply special bandages on the burn. Now, I'm guessing most of you guys don't have any special bandages laying around the house, so there's another thing that you can do. You can grab from your kitchen this plastic wrap thingy, and what you can do is you need to open it up and make sure that 2 turns you discard, because you only want to apply clean plastic wrap. So 2 turns should be about this much. I'm gonna grab it and I'm gonna discard it. Now that I have a clean wrap, I can bandage the wound successfully. Okay? Now, this thing is obviously not as recommended as special burn bandages. However, if it is the only thing that you have, this definitely can help against infections, as well as reducing some of the pain. Because when a patient has a 2nd-degree burn, for example, his nerves are revealed. And so even a blow of air can be painful for him. So this can definitely help. Okay, and that's it. That is how we treat minor burns as well as serious ones. Now, keep in mind, there are a few things that you generally want to stay away from. You don't want to use any lotions or creams unless it's a very, very, very light burn, like a mild sunburn. The reason why you don't want to use lotions and creams is because they can produce an infection in our patient. So if it is a 2nd degree burn or higher, personally, I recommend staying away from those. Next, make sure that if it is a serious burn, then you will not try to apply ice on it or put it under cold water, as I told you with minor burns, because when it is a serious burn, we have danger of our patient getting too cold and going into hyperthermia. And so in very big surfaces of burns or in very serious ones, we generally don't want to cool our patient. And lastly, make sure that when you are using special bandages, that you are not applying direct pressure. You don't want to apply pressure on bandages because after a patient got burned, that area is very, very sensitive, and we don't want to apply pressure on that. Okay, and that is it for this video. Now, I hope you guys are confident to treat burns if you'll need to in the future. Hopefully, you'll only treat sunburns, and even those would be after a very nice vacation on the beach. I hope you guys enjoyed, and I'll see you in the next one. Bye, guys.